All right, we are back with a new solution for that dreaded double chin, the enemy of any good selfie.
In health news, the FDA has approved a new procedure for people who suffer from a so-called double chin.
Is that double chin bothering you? Interested in getting rid of it without surgery? Is it too good to be true? The answer may be a new injectable known as Kybella, or ATX 101. This is a fat-dissolving medication that received FDA approval just recently, this past week, and will be available for us in the US in June 2015. Does it work? What are the risks? How many treatments does it take? Stay tuned to find out more.
It's a miracle, a true blue spectacle, a miracle come true. When a killer, baby, I was going crazy till the miracle.
The idea of injecting a chemical under the skin to achieve fat reduction or lipolysis is not a new concept. It's also known as mesotherapy. This has been in practice since the mid-19th century and still very popular in Europe. In the United States, however, the FDA has not approved any drugs for use in mesotherapy until now. In Europe, lipostabile is the main fat-melting chemical used, dating back to the 1990s, also referred to as flab-jab or lipomelt, lipodissolve, and fat away. The main ingredient in lipostabile is phosphatidylcholine and deoxycholic acid. Mesotherapy on the body is very unpredictable. There is no standardization of dosage, quantity, or frequency established, and it's actually been banned in Brazil in 2003 because of this. But now, the FDA gives clearance to a patented, non-animal derived version of deoxycholic acid. It's a naturally occurring molecule found in the body that aids in the breakdown of dietary fat. In the body, bile is made in the liver, stored in the gallbladder, and used to break up fat when eating a meal. Cholic acid is a bile acid made in the body and is metabolized by the gut bacteria to produce deoxycholic acid. When injecting deoxycholic acid into the body, there have been cases demonstrating toxic side effects, such as effects on the skin and the pulmonary systems. Deoxycholic acid apparently injected into the neck does not seem to have these effects. This low side effect profile is believed to be the fact that the chemical is rendered inactive by tissues that are high in protein, like muscle or like skin, whereas fat has very low protein and therefore very susceptible to a product like Kybella. After injection, it has been shown to be absorbed into the GI tract and therefore does not accumulate at the injection site. Kybella, or ATX 101 in Europe, is a patented non-animal derived version of deoxycholic acid that works by destabilizing the membrane lipids on the fat cell. This leads to fat cell breakdown and induces local inflammatory response that clears the adipocyte or fat cell debris. Additionally, there may be some more subtle mobilization of fat tissue from the fat cells stimulating the beta receptors on the fat membrane. A recent study in a European peer-reviewed medical journal looked at Kybella injected into the neck for submental fat. There were 360 patients involved with moderate to severe submental fat, and they were randomized into 3 groups. One group received ATX 101 at 1 milligram, the other one did ATX 101 or Kybella at 2 milligrams, and then there was a placebo. The protocol was 4 treatments, 4 weeks apart, with a 12-week follow-up. Clinicians and patients rated their improvement based on a scale they determined. Those receiving 1 milligram, the physicians noted that 58% of these patients had significant improvement. 68% of the patients believed that they saw an improvement from 1 milligram. The 2 milligram group, the doctor saw improvement in 62% of the patients, and the patients saw improvement in themselves 64% of the time. That was significant. Injection site pain, swelling, numbness, bruising, induration, just like any kind of injectable, was the main side effect. There was one patient in this group that did have an altered smile as a result of the injection, but this nerve palsy resolved in about 3 months without any kind of intervention. So the big question, will we give it a shot? Well, my feelings are this. Fillers and Botox have become so popular and nonchalant that it is now commonplace for different practitioners to inject with minimal training in non-medical offices such as spas. I do believe the potential for this product to be an effective and safe option is there. but should be performed by someone well trained and comfortable with the anatomy of the face and the neck. There are many important structures residing in this area, and one should not be too cavalier with this product. It's just a matter of time before someone starts injecting this elsewhere to melt fat, or the wrong person injects the wrong amount and there's a resultant complication. In my office, we will thoroughly explore the scientific evidence and acquire the appropriate training if we decide to move forward with this. Maybe I'll try it on myself. Expected to be out in America in June 2015. For more information about Kybella or many of the surgical options and non-surgical options that we offer at Cameo Surgery, please check out our website. And if you haven't subscribed already, please do. Thank you.